arms. These are some of the names you may have heard for the sagging skin under the arms. This is the situation Maria found herself in, even though she's in great physical shape. She decided it was time to shed that skin.
Hello, how are you?
Good, how are you?
I'm Maria. I'm here to see Dr. Mullholland. Well, I'm 49 years old. I've come here to see Dr. Mullholland to take a look at changing the shape of my bat wings, if you want to call it that.
Maria, good to see you.
Hi.
Dr. Mullholland.
And no matter how much diet or exercise I did or weightlifting I did, the arms were never changing their shape. And I found that it was almost uncomfortable wearing sleeveless shirts. For example, this is probably the only one that I have.
Because you have a little bit of loosey-goosey skin and cellulitic skin, I'll do a little what's called an armpit lift.
Okay.
A little small T-shaped cut that removes some of the skin and lifts and pinches. Well, Maria represents a very common subset of body contouring. And so what Maria has, she has a growing extra upper arm skin flesh, both fat and skin, called the bat wing. And of course, that can make a patient's very self-conscious. So what we do for bat wings, we remove fat and we tighten skin. Now, it used to be the dreaded arm lift scar, which would go right from your armpit all the way down your arm. And so now with our new technologies, particularly these heating devices like Body Tight, we can manage with radio frequency energy internally to tighten the skin from the inside. And then we can pull all the skin up into the armpit. So we can do these little armpit scars, combine it with the radio frequency heating technologies, and we can get a good 40, 50, 60% contraction from the inside. Maria, good to see you again.
How are you?
You look great.
Good, thank you.
All tanned. First of all, are you glad you did it?
I'm very happy that I did. Well, it's been 5 months post-surgery, and I can honestly say I look down at my arms and I don't even recognize myself. Even when I walk by a mirror, I have to stop and look and go, ooh, I'm shocked that they've changed that drastically.
And typically at this phase, patients are starting to appreciate why they did it. You know, the first few weeks they're healing, then they get back to work. By about 8 weeks, they're back in the gym, but it's still swollen, it's still numb. And so typically they start to really appreciate things by 3 months. Looks really good by 6 months, looks great by a year.
I'm very happy with the results. I would highly recommend it to somebody who is, considering having something like this done. It changes your whole mindset of feeling more confident.
That is one happy customer right there. Dr. Stephen Mullholland joins me in studio right now. Well, you see the before and afters. So how many inches did Maria actually lose from her arms? So that's pretty dramatic.
Yeah, so she had fabric issues and stuffing issues. So it was a combination of that Body Tight liposuction and tightening, and she lost 5 to 6 inches off each arm.
5 to 6 inches.
It sounds better in Canada, 15 centimeters.
15 centimeters? Oh my goodness.
Yeah.
Okay, in terms of recovery time, how long does that whole process take and what's involved in that?
That's a good question because we use our arms every day. So those that are more sedentary, administrative, on the phone, back in a week. But if you're like in a manufacturing plant and you're lifting heavy boxes, straining, more like 3 to 4 weeks or modified duties.
Okay, and you're saying she wore something on her arms, like to compress?
Yeah, so we shrink wrap the new envelope to become acquainted to the muscle you haven't seen in a while.
Yeah.
And so it's from the mid forearm, becomes a combi sports bra down the other side, and it like Spanx for your arms, basically.
Yes.
And you're wearing that 22 hours a day for 3 weeks, and then for another 3 weeks, half the day. So it's not a middle of July, August procedure, more a fall, spring, winter procedure.
Oh yeah, because you're wearing all the clothes anyways. No one's gonna see. Is there pain involved? Because you see the machine going in there, and it doesn't look like it would hurt, but do you need anesthetic, like freezing?
Yeah, that whole procedure is done under local anesthesia.
Okay.
Sort of like a dentist for your arm, but we're nicer.
Okay.
And so typically I give you a couple little relaxing pills, and we use laughing gas. I put some freezing in your arm or your face or your tummy, wherever we're treating, and then you do the treatment painlessly.
Okay.
The after discomfort, I prefer discomfort than pain.
Okay, fine. So, how uncomfortable is it?
So let's say the worst pain you've ever had, whatever that might be, internal.
Childbirth.
Childbirth. Childbirth.
It's number one.
Childbirth, you know that, or a first marriage, for something like an 8 or 9 out of 10 on pain.
Right.
This is about a 2. Because remember, we're not doing any muscle. There's no muscle work like an augment or tummy tuck where there's muscle work. So it's really, it's painless procedure because it's frozen. And then you have a 2 out of 10 stiff discomfort, like you went to the gym, you worked out the next day, you're going, oh, that's a bit sore, but I can do stuff.
Oh, totally. Okay, I totally understand that. Now, in the past, if someone went in to have a procedure done on their arm, there was a very big scar that was left. We're looking at her after pictures. You can barely see anything. So what is different now to prevent that kind of scarring?
Yeah, so let's say you have and on the show, the tape, we called that bat wing, but that's more of an industry term.
Yeah.
You know, the PC term now would be more of just a fabric concern. Too much fabric, too much stuffing in the fabric, or the fabric's getting frayed.
We're like a sofa, right? Okay, it's
and
fabric.
So if your throw is not, not looking the way you want it to, we can do fabric issues just under topical anesthesia, no cut. If you have too much stuffing in the fabric, we can remove that through that body tight lipo. What women were concerned about, these really long scars. Now we do armpit lifting, and we use those technologies to keep the armpit scar really hidden, and then the last 2/3 we can do, and you really don't see the scar now. So it's removed a lot of the barriers and concerns to getting it done.
So mostly it would be between the elbow and the armpit, and the incision was going to be up here somewhere.
Correct. More hidden in your armpit.
Yeah. Okay. Now, we hear all the time when people have fat removed that it can return. So is there a chance that that fat could return and the skin just gets stretched again?
This is the downside with arms. You know, if you lose, you don't like your arms because you have a genetic predisposition to being big, and you don't like to wear your blouse or your tank top because it just looks very thick. And you try to lose weight, it comes off everywhere else but your arm.
Right.
And so I become like a localized, I've tried everything, let me fix your arm problem. The same thing, if you put on weight, it's going to go elsewhere. There's not much fat left in your arm, but it's going to go where you don't want it. Double chin, back of your neck. It never goes to your lips, your cheekbones. It always goes where you don't want. It never goes there.
Right.
So weight neutrality. Maintain your surgical weight. Your arm will last forever.
Can we talk about cost?
Absolutely. Yeah. The range of cost depends on how big the fabric problem is, the stuffing problem, or the or the excess problem, and so it'd be between $6,000 and $12,000 in Canadian, depending on how big the arm is, how much fat, how much loose skin.
Okay, $6,000 and $12,000 for both arms.
Oh, good point. That's
just
for
checking.
both. We do one arm, see if you like it, come back in 2 years, do the other. Just walk sideways for a year.
This is the good one. Okay, very good. That's great too. That's great information. And you have something that's actually very special for the audience. Dr. Mullholland is sending our audience home with a Universe Skin gift bag that includes serum, cleanser, and neck masks. It's worth $300. To explain exactly what this gift is. It's a pretty unique approach to skincare, and I feel like it's the future of skincare right now. What goes into a bottle of Universe Skin?
So this is pretty cool. Many women are never going to do plastic surgery or even come in for a laser treatment. However, everybody wants nice skin. And the problem is you can get all kinds of great lines over the counter, but you can never get past the active ingredient strength sometimes to remove that brown, remove that red, work on those acne scars, texture, and problems. So 3,000 dermatologists and plastic surgeons around the world got together half a decade ago. And 19 active ingredients, means a physician needs to prescribe it, have gone into this formulation. And we looked at 100,000 photos with different strengths and created this program, a formula, an algorithm. And so you simply send in a photo, the AI, which is the collective intelligence of this process, will look at your photo, identify your unique concerns, and then create a unique formula just for you. And it goes into this serum, 3, 4, or 5 powders. Each doctor mixes it in their office and ships it to the patient, or you come in and visit with the doctor and get it right in the office.
That's pretty amazing.
So it's a bespoke, physician-overseen, algorithm-based formula that actually works. So typically, skincare in the old days, I'd put someone on, you wait 6 weeks, you start to see results in 1 week.
Okay. So really, we would go to the store and buy the serum, and hopefully the serum works on you. Now you get like a program that is specific for your face and your skin, which is incredible. So we're putting all the info about this on our website, that's cityline.tv, and thank you for the gift, and thank you for the info. That was very informative.